Welcome to the pre-admission conference for the Medical Laboratory Technician program at Maysville Community and Technical College. Medical laboratory technicians play a very important role in the healthcare delivery system. MLTs work behind the scenes, performing tests on blood, body fluid, and tissues in all areas of the clinical laboratory. 70 to 80% of all testing performed in the clinical laboratory is used to diagnose, monitor, and treat patients with disease. The program is offered in a face-to-face format on the Maysville campus and in a hybrid format on the Rowan campus. Upon successful completion of the program, you will earn an Associate in Applied Science degree as well as an Embedded Phlebotomy for the Healthcare Worker certificate. The program takes 4 semesters to complete once admitted. My name is Michelle Thurlman, and I'm the coordinator for the Medical Laboratory Technician program at MCTC. I can be located on the Maysville campus in the Science Building on the 2nd floor in room S304A. In this pre-admission conference, I will be covering the application process to the MLT program, where the application materials can be found, how to complete the application packet, specific program requirements for the MLT program, how the selective admissions process works, the health screen requirements as well as criminal background and urine drug screen requirements, how you are notified of acceptance to the MLT program, financial aid and scholarship availability, and remember, the deadline for application to apply to the program is May 1st. Here is an overview of the Medical Laboratory Technician program. You do have to apply for admission to the college, which will require you to submit an official transcript from each college or university previously attended, or an official high school transcript verifying your graduation or official passing GED scores. Attendance at one pre-admission conference per admission cycle is also required, which this video will satisfy. Successful completion of Math 110 or higher with a grade of C is preferred, and you must have a GPA of 2.0 or better in all college coursework. Some of the general education requirements for the program include English 101, Math 110 or higher, a communications course, a computers course, heritage or humanities course, chemistry 140, bio 135 or bio 137 and 139, plus psychology 110. The program is accredited through the National Accrediting Agency for Clinical Laboratory Sciences. So Math 110 must be completed prior to admission to the program. It is a prerequisite necessary for Bio 135 and Chem 140. The first semester of the program, you will have applied phlebotomy, introduction to clinical laboratory, introduction to clinical diagnostic microbiology, as well as a phlebotomy clinical experience. The second and third semesters of the program are full MLT course loads, including serology, urinalysis, clinical diagnostic micro 1 and 2, hematology 1 and 2, clinical chemistry 1 and 2, as well as immunohematology 1 and 2. So those other general education courses will need to be completed during the summer in between your first and second years, or during the spring semester of your second year when you have your MLT clinical practicums. Those clinical practicums, you will be assigned to a clinical site in a hospital laboratory where you will work side by side with MLS and MLT employees who will be training you on the ins and outs of the laboratory and its workflow. The Medical Laboratory Technician application can be found on the Medical Laboratory Technician webpage from the Maysville Community and Technical College website. You can complete the application online, and an email verifying application will be sent to me. You can also schedule a meeting with me if you would prefer to complete the application on a hard copy form. Any and all information materials discussed during this pre-admission conference video are available from me. Make sure that you have completed your application by May 1st. That is the deadline for fall admission. Any incomplete applications will not be considered. So it's your responsibility to ensure that your application is complete and on file by the deadline. Application does not guarantee admission into the program. This is a selective admissions program we will discuss on a later slide. You will be notified via KCTCS email if you've been accepted or denied admission. There will be no information provided by phone regarding acceptance or denial into the program. So make sure you're checking your KCTCS student email account often, and also make sure that you provide an alternate email address on your application form for contact. So part of your information materials include the MLT program, mission, and philosophy. The program will prepare you to play a vital role in the local healthcare delivery system and become adept in collecting and analyzing medical specimens for medical diagnostic purposes. We give you the opportunity to acquire the necessary skills to work under the supervision of a registered clinical scientist or pathologist in a clinical lab, hospital, or other health agency. So you'll learn about collection of specimens from patients, as well as performing laboratory tests in all areas of the clinical lab, including immunohematology or blood bank, clinical chemistry, hematology, microbiology, serology, and urinalysis. You must achieve a minimum grade of C, which is a 74.50 or above, in your MLT courses. And upon completion of this program successfully, you will be eligible for national certification exam as a medical laboratory technician. Any adult 18 years of age or older will be considered for admission to the MLT program as long as you meet the specified requirements for the college as well as the program. The Medical Laboratory Technician Program competencies are listed here. Upon completion of the Medical Laboratory Technician Program, you should be able to perform accurate laboratory testing across all disciplines, ensuring precision, reliability, and compliance with quality control and safety protocols across all levels of testing. You should be able to evaluate laboratory results, detecting and correcting technical errors, and troubleshooting instrument malfunctions to ensure clinically relevant outcomes across all levels of testing. You should be able to implement quality assurance programs and apply problem-solving skills to maintain high laboratory standards across all levels of testing. You should be able to communicate effectively in verbal and written formats to document procedures, convey results, and collaborate with healthcare professionals. You should be able to demonstrate professional integrity, ethical decision-making, and safe specimen collection and handling with adherence to HIPAA regulations while interacting with patients and healthcare professionals. You should also be able to exhibit initiative and self-awareness by recognizing your limitations and seeking assistance for professional growth, culminating with national certification. On the website, you will be able to find the informational materials as well as the application materials for the MLT program. We have already discussed some of the information materials that are included in the informational packet, but additional materials included in that packet include the Selective Admissions Assessment form, which is how your application will be reviewed. Previous college course experience, grades achieved in science and math courses, college GPA, whether or not you've completed all courses at MCTC, if you have healthcare work experience, and also ACT scores if you have taken that test. You will be assigned points based upon this point system. Estimated program fees. The tuition can vary from year to year, but is listed there. Textbooks. The great thing about our textbooks is we use the same textbook for introductory and advanced courses. We do have an ExamSoft, which is an examination software that we can use. We also utilize Media Lab Exam Simulator in the final semester of the program to help students prepare for that national certification exam since they are out in the clinical setting. Uniforms consist of scrubs, lab coat, and clean, neat shoes. I do have disposable lab coats available for use in the student lab on campus, and typically in the clinical setting, students are provided a lab coat if necessary. You do need at least one pair of red scrubs, which is our program color, and a nice white clean lab coat for graduation pictures as well as pinning ceremony. Castle Branch is a web-based receptacle for background checks, urine drug screens, and immunization records. The cost of that is $125. Any additional immunizations or blood work required, of course, is going to vary depending upon where you obtain it. The color deficiency test can be administered here on campus by me. Liability insurance is rolled into your tuition and fees each semester if you are enrolled in a health science program. As far as graduation expenses, cap, gown, MLT pin, those are listed there and can be obtained through the bookstore. The medical laboratory technician national certification exam fee is listed there, and that is through the American Society for Clinical Pathology. I have also listed the phlebotomy technician certification exam fee, but Kentucky is not a state that requires phlebotomists to be certified, although I have had students in the past who have opted to take that certification exam. We do have a one-time student organization fee of $10. Our student organization does fundraisers, community events, campus events, and I do encourage students to get involved with that, as well as state meetings. Clinical rotation is dependent upon the student. The first semester, you have a phlebotomy clinical rotation. The final semester, you have a clinical laboratory rotation. So students should be prepared to travel 50 to 70 miles one way, and those transportation costs are dependent upon the student. Most of our clinical affiliates, especially for the clinical lab rotation, can only accommodate one student at each site. You must maintain a 74.50 or C grade in the program to continue with the proper sequence of courses. If you do not, you can continue in sequence, but your completion will be delayed by a year. In order to continue, you would have to submit an application for readmission. You would have to meet current guidelines for admission to both the college and the MLT program, attend a pre-admission conference and complete the appropriate materials, and make sure all those documents are signed. And of course, readmission will be dependent upon available resources. A student may be readmitted to the MLT program no more than twice, because all MLT courses must be completed within 3 years. Once admitted to the MLT program, there are some health screening documents that are required. The color deficiency evaluation, which can be performed by an optometrist or here on campus by me. Proof of professional liability insurance, which is included with your tuition and fees each semester as a health science student. Hepatitis B immunization, which is a series of 3 shots over 6 months. Or hepatitis B surface antibody testing showing immunity, or a declination waiver can be signed. A urine drug screen is required within 6 months of clinical rotation, as well as a criminal background check within 6 months of clinical rotation. A record of 2 immunizations or IgG titers drawn for rubella, varicella, mumps, and measles is required. A tetanus that is within 10 years time frame. A 2-step TB skin test, which is 2 TB skin tests within 3 weeks of each other, or a quantiferin TB gold or chest x-ray. Flu shot and COVID vaccine are also suggested simply because the time of year we are in clinical rotation at our clinical affiliates. The second packet of information that can be found on the website is the actual application materials. The first of these forms is a student data form. You want to make sure to complete your personal information, including your KCTCS email as well as a personal email. Also, make sure that you designate which campus you are applying for, Maysville or Rowan campus, as well as the year of admission. The second form is a technical standards form. So by signing this form, you state that you possess sufficient visual acuity and color perception, sufficient gross and fine motor coordination to implement lab skills, sufficient communication skills to interact effectively, and also sufficient intellectual, emotional, and physical functions to plan and implement lab duties in a responsible manner. The third form is a statement of understanding. Because we do require a period of assigned guided clinical experiences outside in our clinical affiliates in the community, for educational purposes, you will be practicing on live models or live patients. Students will be practicing on your specimens. You'll be practicing on their specimens. We do use live or real specimens in the student laboratory under training. And then, of course, when you're out in the clinical setting, you will also be exposed to those live patient samples. So no guarantee or assurance has been given by any representative of the college as to any problem that might be incurred as a result of those procedures. Remember, the assigned clinical experience is for educational value only, so no payment should be expected or will be earned. Understand that as a student, you will conduct yourself accordingly, following all required and published personnel policies, standards, philosophies, obtaining all health screening tests, immunizations, criminal background checks, and drug screens required by that agency. You will adhere to the school's policies, rules, and regulations. Understand that any information regarding a patient or former patient is strictly confidential and should only be used in the clinical setting. Understand that your educational experience and knowledge you gain during the program do not entitle you to a job. However, if all objectives and licensure requirements are attained, you are qualified for a job. Understand that any action on your part inconsistent with the above may result in suspension of training. You are liable for your own medical and hospitalization expenses. and you will carry a minimum liability, which is enrolled in your tuition and fees each semester as a health science student. The optional form is the healthcare work experience documentation form. It does have to be required to be completed by an HR representative at your facility of work. Again, that's optional because not everyone is going to have healthcare work experience. And it's not a make or break as far as points are concerned on your application. The final form is a form that you must sign to state that you have listened to this online pre-admission session, you understand everything, and it does require that you put a pre-admission conference verification code on the form, so make sure that you listen to the end. Once you've completed your online application, an email of your application will be sent to me. The deadline for applications is May 1st. All applications will be reviewed by me and recommendations will be made to the MLT Admissions Committee. All applicants will be notified of admission or denial via the email provided on the application. So please provide both your KCTCS and an alternate email. There will be a response form for those students who are admitted to the MLT program. This must be returned to me, accepting or declining your admission into the program. All new admits will be block enrolled in the MLT courses for fall, and any other general education courses you will need to contact me in order to enroll in those. Medical laboratory technicians are in very high demand. The current laboratory workforce has several who are retiring, with not enough new laboratory professionals to fill those open positions. Our current program graduates are starting at $25 to $30 per hour, or $52,000 to $62,000 per year. A lot of those graduates are obtaining full-time positions from their clinical practicum in the final semester of the program. We have several clinical affiliates located in both Kentucky and Ohio. So some of our graduates are working at places like UK St. Clair, University of Kentucky Med Center, Clark Regional Medical Center, Harrison Memorial Hospital, Bourbon Community Hospital, Georgetown Community Hospital, Adams County Regional Medical Center in Ohio, Mercy Claremont in Ohio, Meadowview Regional Medical Center, Fleming County Hospital. So we have graduates spread far and wide. And I also have graduates who are travel techs, meaning they take contracts in other states for short periods of time. And so you can make even more money that way by becoming a travel tech. So this is a very high demand, high wage career choice. The 3-year rolling national certification exam pass rate for the program is 92%. Graduation and employment rates for the program are 100%. Several graduates from our program have went on to complete MLT to MLS online programs through the University of Kentucky, the University of Cincinnati, and the University of Arkansas for medical sciences. Of course, hospitals, the clinical laboratory is the primary employer, but also physician office laboratories, reference laboratories, veterinary laboratories, chemical, pharmaceutical, biotech, research, and public health laboratories are also employment options for graduates of the MLT program. There are financial aid and scholarship opportunities for the Medical Laboratory Technician program. The Work Ready Kentucky Scholarship Program is available for students in the program. The Workforce Innovation and Opportunity Act is administered through TENCO, and there are career centers in Ashland, Maysville, Moorhead, and Mount Sterling. Our national and state organizations like ASCP, ASCLS, and KSCLS also have scholarship opportunities for students, as well as MCTC. Thank you for attending. Feel free to reach out and contact me if you have any further questions. And your conference code is MCTC Proud MLT. Have a great day.